This last year has been really difficult for all of us, but it's been especially hard for people that are trying to conceive, those that are pregnant, and those who are breastfeeding, because what do? And I totally connect with that because I've been there myself. I had a baby in the first lockdown, and yes, I went through all the same questions that everybody is having. But right now we're in such an amazing position because we have a vaccine, and we have a vaccine that works. So what do? If you're pregnant and you're called for your vaccine, should you go? This is a really personal choice. The most important thing that I can advise you as a GP as well is that have all the right information to hand and make an informed decision. Have that conversation with your doctor. You'll never be wasting our time if you call up. We can look at your medical history and we can help you make a risk-benefit based decision. The next thing is, if you are pregnant, what is the benefits of the vaccine? Well, we know that if you get COVID-19 and you are pregnant, you are at a higher risk of ending up in hospital or with serious complications if you were to get it compared to somebody who's not pregnant. Also, we know that 1 in 5 women have a risk of having a premature delivery if they get COVID-19. So the vaccine is very effective in these instances because the vaccine helps reduce serious illness, it reduces hospitalisation, we even know that it reduces transmission. So it's very effective. It's all about what you feel is the right thing for you. Now, if you've already had the Oxford-AstraZeneca vaccine, the question I get asked is, which vaccine should I take? The answer is that we don't have any trial data or evidence at the moment for the Oxford-AstraZeneca vaccine. A recent study, up to 90,000 women received either the Pfizer or the Moderna vaccine, and it was brilliant because we saw that it had no adverse effects on the outcomes of pregnancy. So we are advising and preferring that people that are pregnant get either the Pfizer or the Moderna vaccine over the Oxford-AstraZeneca until such times that we have more data for the other. That said, if you've already had the AstraZeneca vaccine first dose, please attend for your second one, provided you've had no adverse effects. Now, if you are wondering when to get your vaccine, it is safe to get your vaccine at any stage of your pregnancy, but we are recommending that you perhaps wait until your first trimester is over or that you've had your first scan to ensure that everything is okay, and thereafter you can get your vaccine at any stage up until your 3rd trimester. If you are breastfeeding, there is no known adverse effects on your baby. You do not need to stop breastfeeding. You can get your vaccine at any point.